The scope and purposes of HT and HTA. Health Technology Assessment. The main purpose of HTA is to inform policy making for technology in healthcare, where policy making is used in the broad sense to include decisions made at, example, the individual or patient level, the level of the healthcare provider or institution, or at the regional, national, and international levels. HTA may address the direct and intended consequences of technologies, as well as their indirect and unintended consequences. HTA is conducted by interdisciplinary groups using explicit analytical frameworks, drawing from a variety of methods. Purposes of HTA. HTA can be used in many ways to advise or inform technology-related policies and decisions. Among these are to advise or inform 1. Regulatory agencies, about whether to permit the commercial use, example marketing, of a drug, device, or other regulated technology. 2. Payers, such as healthcare authorities, health plans, drug formularies, employers, etc., about technology coverage, whether or not to pay, coding, or the assigning proper codes to enable reimbursement, and reimbursement, or how much to pay. 3. Clinicians and patients, about the appropriate use of healthcare interventions for a particular patient's clinical needs and circumstances. 4. Health professional associations, about the role of a technology in clinical protocols or practice guidelines. 5. Hospitals, healthcare networks, group purchasing organizations, and other healthcare organizations, about decisions regarding technology acquisition and management. 6. Standard-setting organizations for health technology and healthcare delivery regarding the manufacture, performance, appropriate use, and other aspects of healthcare technologies. 7. Government health department officials, about undertaking public health programs, for example immunization, screening, and environmental protection programs. 8. Lawmakers and other political leaders, about policies concerning technological innovation, research and development, regulation, payment and delivery of healthcare. 9. Healthcare technology companies, about product development and marketing decisions. 10. Investors and companies, concerning venture capital funding, acquisitions and divestitures, and other transactions concerning healthcare product and service companies. 11. Research agencies, about evidence gaps and unmet health needs. Many of the types of organizations noted above, including government and commercial payers, hospital networks, health professional organizations, and others, have their own HTA units or functions. Many HTA agencies are affiliated with national or regional governments or consortia of multiple organizations. Further, there are independent not-for-profit and for-profit HTA organizations. As noted above, HTA can be used to support decision-making by clinicians and patients. The term evidence-based medicine refers to the use of current best evidence from scientific and medical research, and the application of clinical experience and observation, in making decisions about the care of individual patients. Basic HTA orientations. The drive for an HTA is not necessarily a particular technology. 3 basic orientations to HTA are as follows. Technology-oriented assessments are intended to determine the characteristics or impacts of particular technologies. For example, a government agency may want to determine the clinical, economic, social, professional, or other impacts of cochlear implants, cervical cancer screening, PET scanners, or widespread adoption of electronic health record systems. Problem-oriented assessments focus on solutions or strategies for managing a particular disease, condition, or other problem for which alternative or complementary technologies might be used. For example, clinicians and other providers concerned with the problem of diagnosis of dementia may call for HTA, to inform the development of clinical practice guidelines, involving some combination or sequence of clinical history, neurological examination, and diagnostic imaging using various modalities. Project-oriented assessments focus on a local placement or use of a technology in a particular institution, program, or other designated project. For example, this may arise when a hospital must decide whether or not to purchase a PET scanner, considering the facilities, personnel, and other resources needed to install and operate a PET scanner, the hospital's financial status, local market potential for PET services, competitive factors, etc. These basic assessment orientations can overlap and complement one another. Certainly, all 3 types could draw on a common body of scientific evidence and other information. Many HTAs will blend aspects of all 3 basic orientations. Properties and impacts assessed. What does HTA assess? HTA may involve the investigation of one or more properties, impacts, or other attributes of health technologies or applications. In general, these include the following. Technical properties include performance characteristics and conformity with specifications for design, composition, manufacturing, tolerances, reliability, ease of use, maintenance, etc. Safety is a judgment of the acceptability of risk, which is a measure of the probability of an adverse outcome and its severity, associated with using a technology in a given situation, example for a patient with a particular health problem, by a clinician with certain training, or in a specified treatment setting. Efficacy and/or effectiveness, both refer to how well a technology works, in example, accomplishes its intended purpose, usually based on changes in one or more specified health outcomes or endpoints. In HTA, efficacy refers to the benefit of using a technology for a particular problem under ideal conditions, example within the protocol of a carefully managed randomized clinical trials, involving patients meeting narrowly defined criteria, or conducted at a center of excellence. Effectiveness refers to the benefit of using a technology for a particular problem under general or routine conditions, example by a physician in a community hospital for a variety of types of patients. Economic attributes or impacts of health technologies can be microeconomic and macroeconomic. Microeconomic concerns include costs, prices, charges, and payment levels associated with individual technologies. Macroeconomic impacts include a nation's gross domestic product, national healthcare costs, and resource allocation across healthcare and other industrial sectors, and international trade. Social, legal, ethical, and/or political impacts arise in HTA in the form of normative concepts, example valuation of human life, choices about how and when to use technologies, research and the advancement of knowledge, resource allocation, and the integrity of HTA processes themselves. The properties, impacts, and other attributes assessed in HTA pertain across the range of types of technology. Thus, for example, just as drugs, devices, and surgical procedures can be assessed for safety, effectiveness, and cost-effectiveness, so can hospital infection control programs, computer-based drug utilization review systems, and rural telemedicine networks.